Good day everyone, my name is Echo, physical therapist. For this episode, let's talk about carpal tunnel syndrome, how it developed, occupational and non-occupational considerations or risk factors, workplace and behavioral adjustments for injury prevention, stretching and strengthening exercises with use of a pencil, and lastly, compilation of exercises for carpal tunnel syndrome via dance movement therapy using the song Shape of You by Ed Sheeran, J Flock cover, Tabata Workout mashup mix by yours truly.
Disclaimer. These are suggested therapeutic exercises only by Echo. It is to provide general self-treatment instructions for conditions that have already been diagnosed by a qualified medical provider. If pain increases or condition worsen, please stop the exercises. The content is not intended to be a substitute for professional medical advice. The information in this video is by no means complete and does not apply to all conditions, especially if you have other health-related issues. May God be with you all.
Carpal tunnel syndrome is a condition involving our wrist and hand, kung saan ang ating ugat named the median nerve as it passes through the carpal tunnel located sa ating wrist area ay naipit. It causes pain, numbness, and tingling sensation sa ating thumb area, index finger, middle finger, and thumb side of our ring finger. Isa din po sa i-complain ng pasyente ay decreased muscle strength, especially when gripping objects. May 9 tendons din kasi na involved. The tendon of flexor pollicis longus, kung saan nagbe-bend ng thumb, and then this one. 4 tendons of flexor digitorum superficialis, na nagbe-bend ng fingers natin, this way, and then this way. And then 4 tendons of flexor digitorum profundus, na nagbe-bend ng ating fingers, specifically DIP flexion, or yung pinakadulo. Ayan, binibend niya. All in all, lahat ng sinusupleyan ng median nerve after it passes to the carpal tunnel ay affected, except the palmar branch of the median nerve, supplying the central base of the palm. Hindi siya affected kasi it branches upstream or proximal to the carpal tunnel. Therefore, there will be no loss of sensation sa palad po natin. So, ito po yung mga dahilan kung bakit ka nagkakaroon ng carpal tunnel syndrome. Number 1 is because of your repetitive wrist and hand movements. Okay? Therefore, work-related siya. Pag yung trabaho mo ay nagtatype ka, or use of mouse, palaging nagalaw to, or let's say sa bahay, pag naglalaba ka, gumagalaw kasi yung wrist and hand mo sa paglalaba, di ba? Tapos, pag ikaw ay mekaniko, yung strong grip. And let's say, nagamit ka palagi ng mga machine na may vibration, let's say hand drill or jackhammer. All in all, pag talagang gamit na gamit yung kamay mo, especially the wrist area, pag palaging nagalaw siya, ay high risk ka po na magkaroon ng carpal tunnel syndrome. Pag din ikaw ay buntis, obese, or mataba po, there will be increased fluid retention sa iyong katawan. So, pag nagmanas itong wrist area natin, may tendency din po maipit yung median nerve. Pag may namana ka pong sakit, like rheumatoid arthritis and diabetes mellitus, pag-diagnose ka din po ng hypothyroidism, high risk ka din po na magkaroon ng carpal tunnel syndrome. And also trauma. Let's say, natulog ka na yung kamay mo ay nasa likod, or let's say, naipit mo yung kamay mo, therefore, maiipit mo din si median nerve. Isa din po sa dahilan, let's say, wrong injection, nagkamali po ng injection sa iyo, tapos tinamaan si median nerve, it might lead to carpal tunnel syndrome din po. Since it is work-related, kadalasan po bilateral or magkabilang kamay po ang affected. Kasi let's say, pag nagtatype ka or sa trabaho, syempre dalawang kamay mo yung ginagamit mo. Therefore, parehas po silang maaapektuhan. So, how to manage it? And also for injury prevention. Number 1, try a softer touch. Masakit na itong wrist and the hand area mo, iwas po tayo sa hard grip. Okay, so light na lang ang paghawak natin ng mga gamit. Number 2, give yourself a break. At least 10 to 15 minutes per hour. Malaki po ang tulong nun. Let's say, office worker ka, tapos syempre, palagi ka nagtatype. Maganda po, iangat mo yung kamay mo. Kasi yung gravity, tinutulungan tayo para yung blood flow, hindi lahat pumunta dito. So, malaki po ang tulong. Kung palagi nakababa ang kamay mo, itaas mo. Number 3, stretch open. Later on, ituturo ko po yung mga ideal stretching na pwede mong gawin para sa carpal tunnel syndrome. Number 4, stay neutral. Sa work kasi talaga, hindi natin maiiwasan na talagang gamitin yung kamay natin. Pero, kung nagpapahinga ka, dapat yung wrist area mo ay diretso po. Ito po yung neutral position ng kamay natin. Tuwid lang po. Okay? Ganyan. Number 5, switch it up. Let's say sa trabaho, right-handed ka, palagi ka nagsusulat sa kanan. Pag may mga kukunin kang gamit, as much as possible, gamitin mo naman si kaliwa. Number 6, watch your posture. Number 7, stay warm. It sounds so simple but it makes a difference. Especially pag nasa cold environment ka, pain and stiffness worsen because of the vasoconstriction of our blood vessels. And number 8, workplace adjustment. For specific adjustment po, mas maganda ay humingi po tayo ng tulong sa isang physical therapist para po specific niya na maipayo sa iyo kung ano yung dapat mong gawin. Kasi very broad yung workplace adjustment, depende kung anong trabaho mo. Okay, for the exercises, number 1 is wrist, flexor, and extensor stretching. Nandito, sa area na to, yung wrist, extensors natin. And then yung nandito sa ilalim, wrist flexors natin. To stretch our wrist flexors, ito po yung gagawin natin. Idiretso mo lang yung siko mo, arms forward lang tayo, tapos yung kamay natin parang naka-stop side. Ganyan. Tapos, hihilahin natin siya. Hawakan nyo lang dito. Kasi mas maganda kasama yung thumb area. Ayan. Stretch nyo lang siya. You will feel a stretch dito sa ilalim ng forearm natin. Okay, so stretching ito para sa wrist flexors. And then for the wrist extensors, ganun lang din po. Diretso lang yung elbow. Tapos, dito naman sa ilalim. Ayan. Ang tension po niyan ay nandito sa upper forearm. Do it for 30 seconds, hold 3 times. Next will be wrist flexor and extensor range of motion exercises. Following the tenodesis effect, when you move your wrist in extension, yung fingers natin nag-curl or nagbe-bend. And then, pag naman binaba natin siya, automatic yung kamay natin ay nagre-relax or tumutuwid. So, ito po yung normal movement ng ating kamay. Ito na mismo yung exercise. This is wrist flexion and extension exercises. Do it for 10 times. Next will be the prayer stretch. Place your palms together overhead. And then, dahan-dahan mo siyang ibaba, maintaining your palm na magkadikit. You will feel a stretch sa ilalim ng iyong forearm. For static stretching, do it for 30 seconds hold, 3 ulit. And then for dynamic stretching, 5 to 10 seconds, tapos kung ilan yung kaya mo. Actually, this is a PT special test. We use this method to confirm if the patient do have carpal tunnel syndrome po talaga. This position will increase pressure in the carpal tunnel. In effect, it compresses the median nerve between the transverse carpal ligament and the anterior border of the radius. Number 4 is shake it off. This exercise is super easy and very useful, especially at night when your symptoms gets worse. Kadalasan kasi, ang may carpal tunnel, mas nararamdaman nila yung pain and tingling sensation after work. Therefore, tuwing gabi. Okay? So, i-shake mo lang yung kamay mo. Malaki po ang may tutulong nito. Take note nga pala, sa pag-shake, I'm very particular. Ang ginagawa ko po is rotation. Okay? Ganyan yung shaking ko. Mas prefer ko ito kaysa yung shaking na paganyan. Mas may tension pag paganto. Yung sa akin, ang shaking na advice ko po ay paikot. Okay? Ganyan siya. Just shake your hands. Pag may pain, numbness, or paresthesia na nararamdaman, especially at night, gantuin nyo lang. Or even in the morning, pag gising mo, shake mo lang yung hands mo. Number 5 is tendon glide. Para gawin yan, syempre neutral position muna sa wrist. And then, gagawin natin yung hook position. Ayan, kung saan yung kamay ay naka-hook. Ayan, ganyan. Okay? And then, closed fist, followed by tabletop. Ayan, ganyan. Ganyan ang itsura. Tapos, fingers on palm. Ayan. Okay? From ganyang pwesto, bababa mo lang. Okay, fingers on palm. Review ulit tayo. Straight, hook, full fist, tabletop, and then fingers on palm. Ang pang-anim natin ay wrist, ulnar, and radial deviation. Fix po yung forearm natin. Ang igagalaw lang natin ay yung wrist area. Yan. Papunta sa left and right lang. Pagpa-bend siya, papunta sa thumb area, ang tawag dyan ay radial deviation. Pagpapunta naman sa fifth finger or sa pinky, yan po yung ulnar deviation. Yan. Next will be median nerve gliding. Okay, before you make this exercise, make sure na medically diagnosed ka na ng medical doctor na meron kang carpal tunnel syndrome. Kasi ugat po ang ating concern dito. Paano yun? So, closed fist with your wrist in neutral. Ganyan. And then, straight yung kamay. Pagkatapos niyan ay wrist extension. Pero yung thumb neutral pa din. And then, thumb extension. Tapos, supination or parang i-rotate mo yung forearm mo palayo sa'yo. Ganyan. And then, thumb pull. Ayan. Yan. Hinila ko po yung thumb. Okay. Gawin natin sa kabila. Closed fist. Wrist in neutral. And then, itataas mo siya straight. And then, wrist extension. Thumb in neutral. And then, thumb extension. Forearm supination. And then, thumb pull. Yan. Ganyan. Okay. Do it for 30 seconds. Hold. 3 ulit for static stretching. Next will be fist to fan. So, closed fist. And then, open mo lang yung kamay mo to the point na i-stretch mo siya. Yan. Yan. That's fist to fan. Do it for 10 times. Next will be thumb touches. One at a time. Yung thumb natin, tsaka yung fingers natin ay papagdikitin natin. Take note tip to tip, mas maganda. Ganyan. Okay? Kasi iba pa kasi to. Yan, iba pa kasi to. Mas maganda yung tip to tip. Pag ganyan siya. Ang tawag natin dyan ay opposition. Thumb opposition. Gawin din natin sa kabila. Yan. Okay, so pag sabay siya, ganyan siya. Okay, malaki po ang tulong niyan. Especially, pag yung pasyente natin may carpal tunnel syndrome na ay may muscle wasting na. Or, yung dexterity, so as yung coordination na ng kanyang hands ay hindi na ganun kaganda. Nangyayari yun kasi ang affected ay median nerve. Next will be wrist and finger pull. For the wrist pull, hahawakan mo lang yung wrist area mo. Yan. Tapos silahin mo lang siya. Yan. Sama mo lahat. Tapos, ganun din dito sa kabila. Hilahin mo lang. Yan. Okay? Finger pull. Kita nyo to, yung nandito sa ito, yung web space po, in between, yung web space, in between our thumb and index finger, isama mo siya. Yan, hilahin mo lang yung yung thumb area mo, mas maganda po if nagtutwist. Ganun din, from the knuckles, hawakan mo lang siya, and then twist mo. Twist with pull. Yan. Malaki po may tutulong yan. Ganun din sa kabila. Ito, sama mo na yung web space. Tapos silahin mo sa thumb area. Tapos index. Yan. Middle finger. Ring finger. And then pinky. Yan. Next will be wrist strengthening exercises using a pencil.
With a pencil. With a fucking pencil.
I know, I've heard the story, sir.
Fucking pencil! Who the fuck can do that?
To use our pencil for strengthening exercise, ipwesto lang natin siya, just like this one, kung saan nasa taas ng pencil yung index finger, tsaka yung fifth finger, and then yung nasa ilalim ay yung third finger, tsaka ring finger. Yan, ganyan yung pwesto niya. Tapos, ayan, pwesto natin na ganito. Merong kasing dalawang klase ng exercise na pwede. So, simulan natin sa multiple angle isometrics. Maganda, merong support. Yung third finger tsaka ring finger will push the pencil upward while the index and fifth finger will oppose the motion. Okay? So, relax lang and then squeeze. Count 1 to 6. 1001, 2, 3, 4, 5, 6. Relax. Taas mo ng konti. Ganun ulit. Squeeze. 1001, 2, 3, 4, 1006. Relax. And then, neutral position kung saan straight na yung wrist. Squeeze. 1001, 1002, 3, 4, 5, 1006. Relax. Taas mo ng konti. And then, squeeze. 1001, 2, 3, 4, 5, 1006. Relax. To strengthen our wrist flexors, baliktad naman yung pwesto. Ganyan naman. Kung saan, si index finger tsaka si fifth finger ay nasa ilalim naman ng pencil, while si middle finger and ring finger, siya naman yung nasa taas. Tapos, babaliktadin mo siya. Okay? Ganyan na, ang pwesto niya. Si index finger tsaka si little finger or yung fifth finger natin ay i-squeeze down niya, while si third and fourth finger will push the pencil upward. You will feel a tension dito sa wrist flexors natin. Okay? So, multiple angle isometrics muna tayo. Ganyan. Squeeze. 1001, 2, 3, 4, 5, 1006. Relax. Taas ng konti. Squeeze. 1001, 2, 3, 4, 5, 1006. Relax. And then neutral. Squeeze. 1001, 2, 3, 4, 5, 6. Relax. Bend ng konti. Squeeze. 1001, 2, 3, 4, 5, 6. Relax. Okay? And now, this is to strengthen our wrist extensors pero via concentric contraction. So, squeeze mo lang siya, tapos itataas mo siya up to neutral position hanggang straight lang. 1, relax. Squeeze. 2, relax. Baba. Hanggang makasampuho. And then, ganun din po, to strengthen our wrist flexors. Ganito naman yung pwesto. Squeeze hanggang straight lang. Relax. Squeeze. 2. Squeeze. 3. Hanggang makasampu po. Next will be dance movement therapy for carpal tunnel syndrome using the song Shape of You by Ed Sheeran, J. Cover, Tabata Workout Mashup Mix by yours truly. So ito po, compilation lang to ng mga exercises na ginawa natin. At 20 seconds on ito, ang gagawin natin mga stretching. Tapos, sa 10 seconds rest, range of motion exercises tayo. Kung ano yung pagkakasunod kanina, yun at yun lang din yun. ang ginawa ko lang sa simula is wrist pull ang gagawin. Tapos sa dulo, finger pull din. Start na natin.
Welcome to Tabata. Here we go in 5, 4, 3, 2, 1, go!
Club isn't the best place to find a lover, so the bar is where I go.
Round 1.
Me and my friends at the table doing shots, drinking fast and then we talk slow. Come over and start up a conversation with just me, and trust me, I give it a chance. Now take my hand, stop, and feel the man on the jukebox, and then
3, 2, 1, stop!
do you know I want your love? Your love wasn't made for somebody like me. Come on now, follow my lead. I may be
3, 2,
crazy, don't
1,
mind me.
go!
Say, boy, let's not talk too much. Grab on my waist and put your body on me. Come on now, follow my lead. Come on now, follow my lead. I'm in love with the shape of you. The push and pull like a magnet.
5,
Although my heart is falling.
3, 2,
I'm in love
1,
with your
stop!
body. Last night you were in my room, and now my bed sheets smell like you. Every day discovering something brand new.
3, 2,
I'm in love with your
1, go!
body. Oh, I, oh, I, oh, I, oh, I. I'm in love with your body. Oh, I, oh, I, oh, I. I'm in love with your body. Oh, I, oh, I, oh, I. I'm in love with your body. Every day discovering something brand new.
3, 2, 1, stop!
Weekend, we let the story begin. We're going out on our first day. You and me, you're 30 days ago. You give me, fill up your bag,
3,
and I fill up
2,
the place.
1, go! My heart is falling too. I'm in love with your body. Last night you were in my room, and now my bed sheets smell like you. Every day discovering something brand new. 3, 2,
I'm in love
1,
with your
stop!
body.
10, 9, 8,
I'm in love with your body.
6, 5, 4, 3, 2, 1.
Love you.
And that is already one set. For progression, you may do it up to 3 sets to be done 3 times a week only. Bakit 3 times a week lang? Kung mapapansin nyo po, ang flow na ginawa ko follows the HIIT principle or high intensity interval training. Supposedly nga, yung 10 seconds rest natin, pahinga talaga. Pero ang ginawa ko, dun ko po inilagay yung range of motion exercises done 10 times. Therefore, sa pasyente po talaga na may carpal tunnel syndrome, ay high intensity po talaga yung ginawa kong dance movement therapy na gagawin nyo lang 3 times a week lang po, MWF or TTHS. During the time na hindi mo gagawin yung exercise na yon, ipahinga mo yung kamay mo. Malaking bagay po na yung kamay mo will stay in neutral position. Kung makakabili ka po ng cock-up splint or wrist splint, to be wear especially at night pag natutulog ka. Pag nakasplint ang ating kamay, naka-neutral yung ating wrist and hand. So malaking bagay po yon para po mapabilis ang ating paggaling sa carpal tunnel syndrome. So how's my episode po? Kindly like and subscribe to my YouTube channel, comment below, or send me a message for your suggestions or critiques.